Hello, this is Kim Jong-il. Today is the second lecture on the Anchorage, and we are going to cover the topic, how to get Anchorage. In the case of protruded lips like this, we have already covered the angulation and anchorage needed. It means that maximum anchorage is needed for the case that the upper incisor angulation is higher than 128 degrees, and the lower incisor angulation is higher than 104 degrees. In the other cases, minimum anchorage and moderate anchorage is needed. In the case of A, U1 to FH is 132, and it means that absolute anchorage is needed. However, maximum anchorage is needed in the lower. In the case of B, U1 to FH is 121, and minimum anchorage and moderate anchorage is preferable. In the case that L1 to MP is 102, moderate anchorage or maximum anchorage is preferable. In the case of C, U1 to FH is 126. In this case, moderate anchorage or maximum anchorage is preferable, and maximum anchorage is preferable because IMPA is 104 degrees. How can we close the space in these kinds of cases? In the case of minimum anchorage, while closing the space, the extraction space would be normally 7.5 millimeters. That's why the anterior teeth should move only 1.9 millimeters backwards. The rest of the posterior teeth should move forward. It means that in the case of 1.9 millimeters, if U1 to FH is around 119 degrees and IMPA is around 95 degrees, maximum anchorage is not necessary but minimum anchorage. So, the anterior teeth move to an aesthetic position and the molars can be moved forward. So, in the case of minimum anchorage, the posterior teeth behind the extraction space should move more forward. How can we get the minimum anchorage? First one is the Darzio 16.022 ideal arch wire with hook. Then, apply crown labial torque to the anterior region. In the case that the condition of the anterior teeth is good, if the incisor moves backwards, it would become unaesthetic. It's better for the maxilla to use an ideal arch wire with hook rather than a combination loop. Second, a deep curve of SPE and excessive overjet is observed. There is a case where the only upper premolar is extracted. In this case, the upper first or upper second premolar can be extracted. In this case, Miabu can be used in the lower and long. Class 3 or short class 3 elastics can be applied to the upper molars. Like this, a combination loop is applied in the maxilla. While closing the space, the anterior teeth move backwards. The posterior teeth also move forward. If the force of class 3 elastics is applied here, the posterior teeth can move much more forward. In the case that there is a deep curve of SPE in the lower, we can level with this force. Next, if minimum anchorage is necessary, it would be preferable to extract the second premolars of upper and lower rather than the upper first premolar. It is because while closing the space, the posterior teeth move more forwards more than the anterior teeth move backwards. In the case of maximum anchorage, when 7.5 millimeters of extraction space is closed, the anterior teeth move backwards by 3/4. So the posterior teeth should move forward by less than 1/4. What about the case of maximum anchorage? If U1 to FH is higher and a 128 and IMPA is higher than 104, maximum anchorage is needed. How can we get maximum anchorage in Mio? First, the upper canine is moved backwards. The upper canine is moved backwards by Anchorage value and then closes upper four incisors backwards. What should we do to the mandible? It's already been labially inclined, so upright them first by round wire and then close the space with shoe hook if there is 12 millimeters of space. However, if there is more than a half of the space, change arch wire in the mandible to Dutter's 16.022 ideal arch wire. At this point, crown labial torque should be applied to the anterior teeth. Then, close the space. In the case of moderate anchorage, when closing the space, the anterior teeth move a half and the posterior teeth move the other half. At this point, if U1 to FH is 123 and IMPA is 99, moderate anchorage is needed. How can we get this? Combination loop should be applied. If a combination loop is applied when closing the space, the anterior teeth move backwards a half, and the posterior teeth move the other half, closing the space. In the case of absolute anchorage, the posterior teeth movement is not preferable. The whole anterior tooth should move backwards. At this point, if U1 to FH is higher than 133 and IMPA is higher than 109, which means absolute anchorage. In other words, extraction space can be closed by using mini screws. You should first classify discrepancy clearly, and if the discrepancy is less than 4 millimeters, the non-extraction can be made. In other words, you can dissolve the discrepancy with the only third molar extraction. In the case of maximum anchorage, to close the space, extract premolars and move the teeth backward as much as possible. In the case of moderate anchorage and minimum anchorage, if the premolar extraction is made, there would be some space. If there is some space, the posterior teeth should move forward if aesthetics is maintained rather than the backward movement of the anterior teeth. In the beginning of the lecture, anchorage was classified. Teeth move by maximum anchorage and minimum anchorage. In the case of teeth movement in maximum anchorage, if there is extraction space and it is aesthetic, you should make sure that the posterior teeth move forward. The anchorage is defined in the diagnosis, but it can also be made based on maxillomandibular anterior teeth relationship during the treatment. Thank you for watching.